there's nobody there.
There you go.
You're on YouTube.
I know.
Anything to
say? Flip you off soon here.
Anything you want to say to America?
A documentary.
Hey, that's Pablo.
Universal health care.
Oh no! I'm a health insurance agent.
You know what? We can all benefit from this. Don't you believe that? I mean,
No.
I hope you do. No.
No. Actually, I don't sell much health insurance. I mainly do life, but I don't believe in universal health care except for some kind of private thing. I don't believe the federal government has any business being in health care. In fact, Medicare and Medicaid, the Great Society, is the reason why things went wrong to begin with.
Well, let me ask you this question.
Oh, good. We got a good argument going on the video.
This is just a question, all right? Because you're a professional. You know this.
Only since 1981, yeah.
Yeah, see, there you go. You're perfect. We spend more for health care in this country than any other nation in the world, but more people don't get health care.
Well, that's not true. That's not true. That's not true.
Our health care system isn't very
What's
good, aside from single payer.
Whoa, wait a second. We have the best health care in the world. We have the best health care in the world. No state in the 50 states allows people to go to a hospital and not be treated.
You need to put the camera on yourself when you're talking.
Oh, I've already put this online so many times. I've had this argument in the Hillary days where we were able to just keep that from happening. What most people don't understand, okay, and it's the same old story. As my grandfather put it, the government can't give you anything that they don't first take away from somebody else. Now, right now, there are people in Canada considered to be one of the better government-run healthcare systems in the world. And right now, if you need a triple bypass in Canada, you'll usually be on a 7 to 9 month waiting list, which is a good way to save on healthcare costs because you just let them die. So what people in Canada do is they mortgage their house and they come to America and have an operation that they need because they can't get it in the government. The government is unable, no government is able to run health care properly. No way, no how. We do spend a higher percentage of our GDP on health care, which is why we have the best health care in the world, and we invent 90% of all the new medicines in this world are invented here in this country. The current government-run healthcare system, the combination of Medicare, Medicaid, now S-CHIP, which is an extension of Medicaid, etc., have all, right now, those comprise the largest socialized medical system in the world. We have, in this country, the largest socialized medical system in the world. Now, as a health insurance agent, perspective you don't have is that this claimed 40 million, 47 million, throw out whatever number you want, of uninsured people are not uninsured. First of all, if they go to the hospital, they will be treated. That's just the law. Next, if they are actually indigent, that is, they can't pay. If they can't pay, they will go on retroactive Medicaid. In other words, they already qualified for Medicaid, they simply hadn't gone on to it yet. Then you have another 30 million people out of those 40-some million people that literally choose not to carry health insurance. It's not that they can't afford it, it's that they choose not to have it. They're self-employed. There's a lot of farmers that I sold health insurance to when I was big in it, and they always buy catastrophic coverage. They would take a $10,000, $15,000, $30,000, $50,000 deductible.
I know about this because of Missouri.
Yeah.
Because they have to insure their farms. They would not choose not to insure their health if they didn't have to insure their farms, which is their first. They
have cash. They have some cash.
So-called government-supported socialized medicine supports the corporations, the pharmaceutical corporations. It's exactly the same with the corporations that pollute the atmosphere. Taxpayers are supporting corporations as if they were social agencies. They're unjust.
Well, all you have to do is pick your poison. The government wastes money everywhere. And you can't think that a government can run. See, I was an economics major, okay? And economics, they're going to play. Economics 101 is simply that anything the government involves themselves takes away from the economy. Always. Always.
You know, you're a smart guy. You know it's much more complicated than that.
I'm not against having health care for those who cannot take care of themselves. I'm not against having health care for people who are poor while they're trying to make their way in life and get somewhere. I am against health care that's run by the government, which is going to cause rationing of health care, which is exactly what they do in every country that has socialized medicine. Some combination of socialized medicine and the private sector has been working in this country to produce the best health care in the entire world.
We have really unhealthy nation.
It's not because of the medical system, it's because we're rich. When we're rich, we get to smoke cigarettes or drink booze or get fat. Now that's not a health care provider problem.
You know that the gap between the rich and the poor has increased exponentially in this country in the past 30 years.
No, not really. The middle class is still about the same percentage as it was at that time. If you're talking about the difference between the very rich, say when you take the old bell curve of life, you take the bottom 5% and the top 5%, there's a much wider gap between those two. But the middle class is still pretty much the same percentage of people in this country. And a lot of those people in that middle class choose not to buy health insurance, but instead wait till a catastrophe happens and file bankruptcy, which is just the way the crazy system works. But there's others that pay their own way. They just choose to do it that way.